What is a hydroselectomy and what is a hydrocele? Well, hydroselectomy is removal of the hydrocele, but if you don't know what a hydrocele is, then you don't know what a hydroselectomy is. If you do, then you do. Then I guess it's really about a hydrocele. So what is a hydrocele? A hydrocele is basically an accumulation of water or liquid inside the scrotum. It's not really inside the scrotum, it's actually right next to the testicle. So the testicle, a little bit of like embryology, comes down to the scrotum from the back of the body. So the gonads, which are basically a bunch of tissue that forms in the embryo that eventually makes it down after becoming a testicle all the way down into the scrotum, comes from the back of the body, right where the kidneys are. So that's why testicular pain, okay, you can feel it in your belly, because the nerves that supply the testicle are actually same as the nerves that supply the kidney and the inside of the body. So it's really, really interesting, because actually the testicles, before becoming testicles, were undifferentiated gonads, which were basically something that could either become an ovary or a testicle. And you know that the ovaries are actually sitting in the body right next to the uterus. So that tells you the testicles came down just like the ovaries, and then they went all the way down into the scrotum. So on their way down to the scrotum, they took, okay, with them part of the lining of the inside of the body. And the inside of the body, okay, it's called the lining is called peritoneum. Peritoneum basically is a layer, okay, of connective tissue that is mostly made to be able to slide. And the reason why is because the bowels are always sliding inside the body. If they weren't, they wouldn't be able to actually properly function and digest. So there, in the peritoneum, there is a peritoneal fluid that sits almost like a lubricant. And when the testicles came down from the back of the body, they took part of this envelope with them and they brought it all the way to the scrotum. And then eventually the envelope, if you think about it, like imagine it like this, and they take it with them. So now it comes through the outside, from the inside, comes through the inguinal canal, and then part of it is just sitting right outside of the testicle. If there is a communication between that part of the envelope that's sitting right by the testicle and the inside of the body, while fluid can easily come down from the inside of the body and then accumulate in that part right next to the testicle. And if it does, then this accumulation of the fluid is called a hydrocele. Sometimes, even without communicating, it still makes a hydrocele, because the lining itself is almost programmed to be able to make some fluid itself. So that's a hydrocele. And why would that be a problem? Well, it would be a problem if the hydrocele became so big that it became very impractical. A man has a scrotum, it's not supposed to be super big. If it's super big, then you start sitting on it and it starts being quite painful, and it becomes almost debilitating, because even if you're just walking and this thing hanging, you can just squish it, and it'll be very painful. So if you're squishing your scrotum because it's becoming so big, then we can fix it. We can remove the hydrocele, and now you don't have to worry about having a scrotum that's too big. If you find yourself lifting your scrotum to sit down, that's also an indication that your scrotum is getting way too big. And if it gets too big, you can hurt it, you can sit on your testicles. So instead of doing that, we can just remove that bag of water, and then you can sit comfortably without having to worry about your scrotum. So that's what a hydrocele is, and that's how we do a hydroselectomy.